Hello and welcome to EquiHerbal. I'm Kayla Dendy, your master herbalist. Today we're diving into the world of herbs, specifically Angelica. But here's a key point. There are two main types of Angelica. One is used in traditional Chinese medicine, the other in Western herbalism. This episode focuses on Angelica Sinensis, or Dong Quai, a cornerstone of Chinese herbal medicine and a celebrated tonic for women's health. Next week we'll explore Angelica officinalis, the Western counterpart. Understanding the difference is crucial. Each has unique uses and effects. Dong Quai's reputation as a supreme tonic for women is legendary, with a history stretching back thousands of years. We'll explore its history, traditional uses, and what modern science says about it. By the end, you'll see why Dong Quai is so highly regarded. Let's begin our journey into the world of this remarkable herb. In traditional Chinese medicine, Dong Quai is the go-to tonic for women's health. It's used daily by millions to regulate menstruation and nourish the blood. Rather than a quick fix, it's seen as a food for ongoing balance and vitality. Dong Quai also supports circulation, which is key to its broad benefits. Its sweet, pungent aroma is familiar in Chinese kitchens, where it's often added to soups and stews. This culinary use integrates its healing properties into daily life, a hallmark of Chinese medicine. Slow, steady use builds the body's resources, especially for chronic conditions. Its warming, restorative nature makes it ideal for colder months or those feeling depleted. Let's look closer at how Dong Quai achieves these effects. Angelica Sinensis, or Dong Quai, is also known as Dang Gui or Chinese Angelica. Native to the cool, mountainous regions of China, Japan, and Korea, it's now widely cultivated. This aromatic perennial belongs to the carrot family, with feathery leaves and hollow, purplish stems. It grows up to 3 feet tall and blooms with clusters of small white-green flowers in summer. The real treasure is underground, the thick, yellowish-brown root, prized for its medicinal power. The root's sweet, musky aroma signals its quality. In Chinese medicine, different parts of the root are used for specific purposes, reflecting centuries of nuanced practice. The main root and its tails each have unique therapeutic actions. This attention to detail highlights the sophistication of traditional herbalism. Dong Quai's root is the foundation of its healing legacy. Let's see how it's cultivated and prepared. Growing Angelica Sinensis means mimicking its native, cool mountain environment. It thrives in moist, well-drained soil, humus-rich and often in partial shade. Seeds need cold stratification, so growers often use root division or nursery seedlings. Plants are spaced for healthy root development and require careful watering and pest management. Roots are harvested in autumn of their second or third year, when medicinal potency peaks. Harvesting is done gently to avoid damaging the roots. After cleaning, roots are slowly dried in the shade to preserve their active compounds. Rushed drying destroys valuable oils and aroma. Once dried, the root is ready for use in teas, powders, and traditional dishes. This careful process preserves Dong Quai's healing power. Dong Quai's use dates back to 588 BC, making it a pillar of Chinese herbal tradition. It's second only to licorice root in popularity and importance. Traditionally, it strengthens and harmonizes the heart, lung, and liver meridians, key to vitality and the flow of qi. It's valued as a systemic tonic, not just a remedy for one symptom. Dong Quai also moistens the intestines, easing constipation linked to dryness and deficiency. Its blood-nourishing action supports tissues throughout the body. This holistic approach is central to traditional Chinese medicine. Dong Quai's versatility makes it indispensable for herbalists. Its legacy is a living tradition, proven over thousands of years. While Dong Quai has many applications, its principal and most celebrated use has always been for addressing female health concerns. It's often referred to as the female ginseng for its supreme ability to nourish and support the female body through all its life stages. Its reputation is really built on its profound effect on the female reproductive organs, and specifically the smooth muscles of the uterus. For centuries, it has been the go-to herb for a spectrum of menstrual difficulties. In traditional Chinese medicine, the root, known as Dong Gui, is classified as both a blood tonic and a blood mover, and that dual action is really key to its effectiveness in treating disorders related to the menstrual cycle. This dual classification is central to understanding its traditional application for menstrual health. As a blood tonic, it's used to address underlying deficiencies, particularly of blood, which can show up as a pale complexion, fatigue, or scanty or absent periods, what we call amenorrhea. By nourishing and building the blood, Dong Quai helps ensure there is an adequate foundation for a healthy cycle. As a blood mover, it addresses stagnation, which in TCM theory is the primary cause of pain. This invigorating action helps to resolve clots, ease cramping, and promote a smooth, regular flow, making it invaluable for women who suffer from painful periods, also known as dysmenorrhea, or from an irregular menstrual cycle that lacks a predictable rhythm. The specific part of the root used can also be tailored to the condition. As mentioned previously, TCM practitioners differentiate between the root head, called Dang Gui Tu, the root body, or Dang Gai Shen, and the root tail, known as Dang Gui Wei. The root body is considered the most balanced, offering both blood tonifying and blood-moving properties. The root head is believed to be more effective at stopping bleeding, while the root tail is considered the most potent for invigorating the blood and breaking up stasis. This nuanced approach allows a skilled herbalist to create highly customized formulas that precisely match the patient's unique pattern of imbalance, maximizing the therapeutic outcome for their specific menstrual complaint. Beyond menstruation, Dong Quai's affinity for the female system extends to other significant life phases. It's commonly used as a postpartum tonic to help a new mother recover her strength, replenish the blood lost during childbirth, and restore balance to her system. It's also found in formulas designed to ease the transition through menopause, helping to mitigate symptoms like hot flashes and dryness, which are often attributed to a decline in the body's essential fluids and blood. This lifelong support is why Dong Quai is revered not just as a medicine, but as a true ally for women, earning its esteemed title as the Queen of Female Herbs. While Dong Quai is most famous for its role in gynecology, its traditional uses in Chinese medicine extend far beyond the female reproductive system, touching upon nearly every aspect of health and wellness. Chinese herbalists have utilized its powerful properties to manage a variety of painful conditions. For instance, it has been a key ingredient in formulas used to treat rheumatic arthralgia or joint pain, especially the kind that gets worse with cold and damp conditions. Its ability to move blood and warm the channels is believed to help dispel the stagnation and cold that cause pain and stiffness in the joints. Similarly, it has been used to alleviate general abdominal pain and to manage post-operative pain, helping to improve circulation and speed recovery. The concept of moving blood is also really critical to its use in treating physical injuries and promoting healing. In TCM, traumatic injuries like bruises, sprains, and fractures cause a local stagnation of blood and qi, leading to swelling, discoloration, and sharp, fixed pain. Dong Quai is often included in formulas to invigorate the blood in the affected area, breaking up this congestion. This action is thought to not only relieve the pain, but also to clear away the toxic reaction of injured intracellular fluid, thereby accelerating the repair of damaged tissues. This improved blood vascular condition is also why it has been used for seemingly unrelated issues like tinnitus, blurred vision, and palpitations, which can sometimes be linked to poor circulation to the head and heart. In addition to pain and injury, Dong Quai has been traditionally used for a range of internal medicine conditions. Its blood tonifying properties make it a primary herb for treating various types of anemia, helping to restore healthy blood levels and alleviate associated symptoms like fatigue, dizziness, and a pale tongue. It has also found a place in the complex management of chronic liver conditions, such as chronic hepatitis and even liver cirrhosis. In these cases, it is thought to help nourish the liver blood and soften the liver, working in concert with other herbs to restore the organ's function. This demonstrates its role not just as a symptom reliever, but as a deep-acting tonic for vital organs. Other historical applications described in folk medicine further illustrate the herb's versatility. It has been used in formulas to treat dehydration, which suggests a recognition of its moistening, fluid-generating properties. Its use for lumbago, or lower back pain, again points to its ability to move blood and alleviate stagnation and pain. Furthermore, it has been included in treatments for hypertonia, meaning excessive muscle tone, and various nervous disorders, where its calming and nourishing effects on the blood and liver are thought to help soothe the spirit and calm the mind. These diverse applications really underscore Dong Quai's status as a systemic herb, capable of restoring balance and promoting healing throughout the entire body. To truly appreciate how Dong Quai exerts its profound effects on the body, we must look deeper into its chemical makeup. The root of Angelica Sinensis is a complex natural pharmacy, containing a rich array of bioactive compounds. Among the most significant of these are its volatile oils, which are responsible for the herb's characteristic pungent and sweet aroma. These oils are not just for fragrance, they contain key active constituents, with one of the most studied being ligustilide. This compound is a major component of the essential oil and is believed to be a primary contributor to many of the herb's therapeutic actions. It is a phthalide, a class of compounds known for their potent biological activities across various systems in the body. Ligustilide has been the subject of extensive scientific research, which has revealed its powerful antispasmodic properties. This means it has the ability to relax smooth muscle tissue, which is found in the walls of the uterus, the intestines, and blood vessels. This action provides a clear scientific explanation for Dong Quai's traditional use in relieving menstrual cramps. When the uterine muscles contract too strongly or irregularly, they can cause significant pain. The ligustilide in Dong Quai helps to soothe these contractions, making them less intense and more coordinated. This calming effect is not limited to the uterus. It also helps relax the smooth muscles in other parts of the body, contributing to its broader benefits. Another crucial group of compounds found in Dong Quai are the coumarins. These are naturally occurring plant chemicals that have a wide range of physiological effects. While some coumarins are known for their strong, blood-thinning properties, the types and concentrations found in Dong Quai are generally considered to have a more subtle, regulatory effect. They contribute to the herb's overall ability to improve circulation and prevent the kind of blood stagnation that, in traditional Chinese medicine, is seen as a root cause of pain and disease. These compounds work synergistically with the other constituents, enhancing the herb's ability to act as a blood mover and ensuring that vital energy and nutrients are delivered efficiently throughout the body. The combination of volatile oils like ligustilide and various coumarins creates a powerful therapeutic synergy. This explains why Dong Quai can simultaneously relax uterine musculature while also invigorating blood flow. It is not just one chemical doing one job, but a complex interplay of many constituents working together. Some components may increase uterine tone, while others relax it, leading to a net effect of normalization and regulation. This dual-directional activity is a hallmark of many adaptogenic and tonic herbs, allowing them to restore balance rather than simply pushing the body in one direction. This inherent intelligence is what makes Dong Quai such a valuable and revered herb in traditional practice. Another of Dong Quai's most important active ingredients is ferulic acid. This potent antioxidant is found in many plants, but it is particularly abundant in Angelica Sinensis and is considered a key marker for the herb's quality. Ferulic acid plays a critical role in the herb's celebrated effects on the circulatory system. Modern research has shown that it can effectively inhibit the polymerization of platelets in the blood. Platelets are cell fragments that are essential for normal blood clotting, but when they become overly sticky or activated, they can clump together, leading to poor circulation, blood clots, and an increased risk of thrombosis. Ferulic acid helps to keep the blood flowing smoothly by preventing this excessive platelet aggregation. This action has been confirmed in multiple studies. Both isolated ferulic acid and a simple aqueous extract of the whole Dong Quai root were found to significantly inhibit platelet aggregation and the subsequent release of serotonin. Serotonin release from platelets is a key step that further promotes clotting and can cause blood vessels to constrict, further impeding blood flow. By moderating this process, Dong Quai helps to maintain healthy circulation and vascular health. This mechanism directly supports its traditional use as a blood mover and provides a clear rationale for its application in conditions related to poor circulation, such as pain from traumatic injuries, certain types of headaches, and even chronic conditions where microcirculation is impaired. Alongside ferulic acid, Dong Quai also contains beneficial phytosterols. These are plant-based compounds that are structurally similar to the cholesterol found in animals. While they are not considered primary active constituents in the same way as ligustilide or ferulic acid, they contribute to the overall health-promoting profile of the herb. Phytosterols are known to have anti-inflammatory effects and can help support cardiovascular health. Their presence in Dong Quai adds another layer to its therapeutic value, complementing the actions of the other compounds. They can help to soothe inflammation within the blood vessels and contribute to a healthier lipid profile, further supporting the herb's role as a circulatory and cardiovascular tonic. The combined action of ferulic acid and phytosterols makes Dong Quai a powerful ally for the entire vascular system. By preventing excessive clotting, reducing inflammation, and promoting smooth blood flow, these constituents help to ensure that every part of the body receives the oxygen and nutrients it needs to function optimally. This is particularly important for the female reproductive system, where healthy blood flow is essential for a regular menstrual cycle, a healthy uterine lining, and successful implantation. The circulatory benefits of these compounds underpin many of Dong Quai's most famous uses, from relieving menstrual pain to promoting recovery from injury and supporting overall vitality. Beyond the better-known compounds, Dong Quai root is also a rich source of polysaccharides. These are complex, long-chain carbohydrates that are much more than just a source of energy. The specific polysaccharides found in Angelica Sinensis have been shown to possess impressive immunomodulatory effects. This means they do not simply boost or suppress the immune system, but rather help to regulate it, bringing it back into a state of balance. Research has demonstrated that these compounds can stimulate the activity of key immune cells, such as lymphocytes and macrophages, enhancing the body's ability to fight off infections and patrol for abnormal cells. This provides a scientific basis for the herb's traditional use in strengthening the body's defenses. These polysaccharides also contribute to the herb's anti-inflammatory and tissue-healing properties. They have been shown to possess significant antioxidant activity, helping to protect cells from the damage caused by free radicals. This is particularly relevant for conditions involving chronic inflammation, such as inflammatory bowel disease. Furthermore, studies suggest these compounds can promote the healing of gastrointestinal wounds, supporting the integrity of the gut lining. This action aligns with Dong Quai's traditional use for lubricating the bowels and supports its inclusion in formulas aimed at healing and soothing the digestive tract, demonstrating that its benefits extend well beyond the circulatory and reproductive systems. Another important class of active compounds found in Dong Quai are the polyacetylines. These are highly reactive molecules that have demonstrated a range of biological activities, including anti-inflammatory, antimicrobial, and anti-tumor effects. In the context of Dong Quai, certain polyacetylines are believed to contribute to its ability to modulate uterine function. The complex chemistry of the root allows it to have what appears to be a dualistic effect on the uterus. Depending on the pre-existing state of the uterine muscle, components within the herb can either stimulate weak contractions or relax overly strong, spastic ones. This normalizing effect is the very definition of a uterine tonic. This ability to both tonify and relax is what makes Dong Quai so uniquely effective for a wide range of menstrual issues. The polyacetylines, working in concert with ligustilide and other constituents, help the uterus achieve a more coordinated and rhythmic pattern of contraction. This can lead to a more efficient and less painful menstrual period. It is this intricate dance of chemical constituents, the volatile oils, coumarins, ferulic acid, polysaccharides, and polyacetylines, that gives Angelica Sinensis its remarkable healing intelligence. The whole root is truly greater than the sum of its parts, providing balanced, multifaceted support for the body. The most prominent and well-documented clinical use of Dong Quai revolves around its role as a premier uterine tonic. For centuries, it has been the cornerstone of herbal formulas designed to support female reproductive health through every stage of life. Its primary application in this area is to address menstrual irregularities and discomfort. Practitioners prescribe it to help regulate the menstrual cycle, bringing predictability to cycles that are too long, too short, or erratic. It is particularly valued for its ability to relieve the pain and cramping of dysmenorrhea. The herb's unique constituents help to normalize uterine contractions, transforming painful, spastic cramps into more coordinated, functional movements that facilitate a smoother menstrual flow. Beyond pain relief, Dong Quai is famous in China as a powerful blood tonic. This concept is central to its therapeutic value, as healthy blood is considered the foundation of vitality in traditional Chinese medicine. It is a primary herb for treating anemia, helping to build blood and alleviate the associated symptoms of fatigue, dizziness, and a pale complexion. This blood-building capacity is especially crucial for women who experience heavy menstrual bleeding, as it helps to replenish lost reserves and prevent the development of deficiency and anemia. Its use as a postpartum tonic is also directly related to this function, helping new mothers recover their strength and rebuild their blood after the rigors of childbirth. The herb's benefits for women extend into the menopausal transition. While research on its use as a standalone treatment for menopausal symptoms like hot flashes is inconclusive, It is a key component in traditional formulas designed to ease this life stage. In traditional Chinese medicine, many menopausal symptoms are attributed to a decline in blood and yin, leading to a state of relative heat and dryness. Dong Quai's ability to nourish blood and moisten tissues can help to rebalance the system, providing a foundation for other herbs to work more effectively. It helps to support the body's core vitality, making the transition smoother and less disruptive to a woman's overall well-being and daily life. Another fascinating application relates to its fetus-stabilizing properties. In certain cases of threatened miscarriage, particularly those associated with a pattern of blood deficiency and uterine coldness, qualified practitioners may use Dong Quai in specific formulas. It is thought to improve the health of the uterine lining and enhance circulation to the womb, creating a more stable and nourishing environment for a developing pregnancy. Furthermore, it has been observed that Dong Quai can enhance the body's utilization of vitamin E, a nutrient vital for reproductive health. This may be one of the biochemical mechanisms that explains its traditional use in both promoting and sustaining a healthy conception and pregnancy. Beyond its gynecological applications, Dong Quai is highly regarded for its effects on the entire circulatory system. It is classified as a warming herb in Chinese medicine, a designation that speaks to its ability to improve circulation, especially to the periphery of the body. Many people who suffer from chronically cold hands and feet find relief with formulas containing Dong Quai. This circulatory stimulant effect is not just about comfort. It ensures that vital oxygen and nutrients are efficiently delivered to all tissues, while metabolic waste products are effectively removed. This improved blood flow is fundamental to the body's ability to maintain health, heal from injury, and resist disease, making it a key action of the herb. This circulatory action is also why Dong Quai is so useful in the treatment of abscesses and boils, as well as for pain from traumatic injuries. In both cases, there is a localized stagnation of blood and fluids that causes swelling, pain, and a buildup of toxic substances. Dong Quai helps to invigorate the blood, breaking up this congestion and flushing the area. This cleansing and purifying effect on the blood promotes better circulation, which directly relieves the pain caused by the toxic reaction of injured and congested intracellular fluid. By restoring healthy flow, it accelerates the healing process, reduces swelling, and helps to resolve the underlying inflammation associated with these conditions. The herb's anti-inflammatory properties are also significant. It has been shown to have an effect on prostaglandin synthesis, which is a key pathway involved in the body's inflammatory response. By helping to regulate the production of these compounds, Dong Quai can help to manage inflammatory conditions throughout the body. This is relevant for everything from inflammatory joint pain to inflammatory responses within the reproductive tract, such as those seen in endometriosis. Its ability to modulate inflammation, combined with its circulatory benefits, makes it a powerful and versatile tool for managing a wide range of pain syndromes that have an inflammatory or stagnant component. Furthermore, Dong Quai has demonstrated anti-allergic and antiseptic properties. It has been reported to have an antibiotic effect against several common strains of bacteria, including E. coli, Streptococcus, and Shigella. While it is not a substitute for conventional antibiotics in acute infections, this action contributes to its overall ability to help the body maintain a healthy microbial balance. Its anti-allergic effects may help to modulate the immune system's response to allergens, potentially reducing the severity of hypersensitivity reactions. These broader actions showcase Dong Quai as a multifaceted herb that supports the body's health through various interconnected mechanisms, including circulation, inflammation, and immune response. The therapeutic benefits of Angelica Sinensis are not limited to human use. They have also been successfully applied in veterinary medicine, particularly for our equine companions. In veterinary herbalism, Dong Quai is often indicated for conditions that mirror its human applications, especially those involving the digestive and circulatory systems. For horses, it is used in cases of ulcerative colitis and other inflammatory bowel conditions. Its anti-inflammatory and wound-healing properties, attributed in part to its rich polysaccharide content, can help to soothe the inflamed lining of the colon, promote tissue repair, and restore healthier gut function in affected animals, providing a natural supportive therapy. Anemia is another condition where Dong Quai finds its place in equine care. Horses, like humans, can suffer from anemia due to poor nutrition, chronic disease, or blood loss. The herb's well-established blood tonifying properties make it a valuable addition to an anemic horse's regimen. By helping to build red blood cells and improve the overall quality of the blood, it can help to increase the horse's energy levels, stamina, and general vitality. This is particularly useful for performance horses recovering from strenuous activity or for older horses who may struggle to maintain optimal condition. It addresses the root deficiency, helping to restore the animal's natural vigor and health from the inside out. Veterinarians and herbalists also use Dong Quai to address pain and musculoskeletal issues in horses. It is frequently included in formulas for managing abdominal pain or colic, especially when there is a component of intestinal cramping or spasm. Its anti-spasmodic action helps to relax the smooth muscles of the gut, easing discomfort. Furthermore, its ability to invigorate circulation is highly beneficial for treating bruising and soft tissue injuries. When a horse sustains a traumatic injury, the resulting stagnation of blood can significantly delay healing. Dong Quai helps to improve blood flow to the injured area, which speeds up the resolution of swelling and bruising and promotes faster tissue repair. Constipation is another common issue in horses that can be addressed with Dong Quai. Just as in humans, the herb acts as a gentle bowel lubricant, helping to moisten dry stool and promote smoother, easier passage. This is especially helpful for horses that may be prone to impaction colic, or for older animals whose digestive motility has slowed. The use of Dong Quai in these varied veterinary applications, from gut health and anemia to pain management and injury recovery, demonstrates the herb's fundamental and versatile actions. It offers a way to support the health and well-being of our animal partners by addressing core physiological imbalances in a gentle yet effective manner. The clinical applications of Dong Quai, really do extend to several other major body systems, highlighting its role as a true systemic tonic. In the digestive realm, beyond its use for constipation, it's known to strengthen overall digestive function. In the framework of traditional Chinese medicine, a healthy digestive system is considered the source of all postnatal qi and blood. By warming the abdomen and improving circulation to the digestive organs, Dong Quai helps to enhance their function, which leads to better nutrient absorption and transformation. This makes it a valuable component in formulas for individuals with weak digestion, poor appetite, or just a general feeling of depletion, helping to build the body's foundational energy. Perhaps one of its most impressive areas of influence is on the cardiovascular system. Research has shown that Dong Quai possesses quinidine-like activity on the heart. Now, quinidine is a pharmaceutical drug used to treat irregular heart rhythms. Dong Quai has actually been found to help correct experimental atrial fibrillation and can prolong the refractory period of the heart muscle, which helps to stabilize its rhythm. Animal studies have also shown that it can dilate the coronary arteries, thereby increasing blood flow to the heart muscle itself. This action, combined with its ability to lower blood pressure in some models, really underscores its profound potential as a cardiovascular tonic. This protective effect on the heart muscle, or myocardium, has been demonstrated in some pretty compelling animal studies. A water-based extract of Dong Quai showed a marked protective effect against myocardial injury and dysfunction that was induced by ischemia, a lack of oxygen. This suggests the herb may help to protect the heart during periods of stress and reduced blood flow. The combination of increased coronary flow, reduced blood pressure, and anti-arrhythmic potential makes it a powerful ally for long-term heart health. It works not by forcefully altering function, but by nourishing the heart blood and improving the circulatory dynamics that support the entire cardiovascular system. Finally, Dong Quai has been studied for its potential benefits in kidney health, particularly when combined with another powerful herb, astragalus. An herbal preparation containing both astragalus and Dong Quai has a long history of use in China for treating nephrotic syndrome. A modern animal study investigated this combination's effects on renal fibrosis, which is a scarring process that leads to a progressive deterioration of kidney function. The study found that the herbal mixture retarded the progression of this fibrosis and the decline of renal function, with an efficacy that was comparable to the ACE inhibitor drug enalapril. This really demonstrates the potential of traditional formulas to protect vital organs and manage complex chronic diseases. Modern scientific investigation has delved deeply into the biochemical mechanisms behind Dong Quai's traditional uses, with a significant focus on its polysaccharide content. These complex carbohydrates have been shown to possess a remarkable range of pharmacological effects. Published research confirms that the polysaccharides of Angelica Sinensis are powerful agents of immunoregulation, helping to balance and normalize the body's immune responses. They also exhibit significant antioxidation and anti-tumor activity in various experimental models. Furthermore, these compounds have been observed to protect against irradiation injury, promote hematopoiesis, meaning the formation of blood cellular components, and even accelerate the healing of gastrointestinal wounds in both in vitro and in vivo studies in rats, really validating many of its traditional applications. One particularly compelling area of research involves Dong Quai's effect on inflammatory bowel disease. A study focusing on immunologic colon injury in rats found that Angelica Sinensis had a significant protective effect. The researchers concluded that this benefit was likely due to a combination of mechanisms, including its powerful antioxidant properties, its ability to modulate the immune system, and its direct promotion of wound repair within the colon. These findings strongly suggest that Dong Quai may be a useful therapeutic agent in the management of human patients with inflammatory bowel disease, such as ulcerative colitis or Crohn's disease, offering a natural approach to soothe inflammation and support the integrity of the gut lining. The herb's influence on blood and circulation has also been rigorously studied, particularly its antithrombotic activity. Both in vitro and in vivo studies have consistently shown that extracts of Dong Quai root can effectively inhibit platelet aggregation, which is the clumping of blood cells that can lead to clots. This is highly relevant for conditions like ulcerative colitis, where vascular endothelial cell injury can lead to significant platelet activation. A notable study compared 3 groups: patients with active ulcerative colitis, those with remissive colitis, and healthy individuals. The results demonstrated that adding Dong Quai injections to routine treatment significantly inhibited platelet activation, relieved the underlying vascular endothelial cell injury, and improved microcirculation in patients with active ulcerative colitis. Further research has illuminated the nonspecific immunostimulatory effects of Dong Quai, particularly on lymphocyte proliferation. These studies consistently show that Dong Quai enhances cell-mediated immune responses and promotes nonspecific lymphoproliferation in vitro, meaning it encourages the growth and activity of key immune cells without a specific target. On another front, a specific polysaccharide extracted from Dong Quai has demonstrated notable anti-tumor effects in experimental tumor models. This compound was also shown to inhibit the invasion and metastasis of hepatocellular carcinoma cells in vitro, suggesting a potential role in cancer therapy by helping to prevent the spread of cancer cells, which is a major goal in oncology. The therapeutic potential of Angelica Sinensis extends into the realm of neurological health, as evidenced by a large-scale study on its effects on acute cerebral infarction, which is a type of stroke caused by a blockage in a blood vessel supplying the brain. In this extensive clinical trial involving 1,404 patients, individuals were divided into 3 groups. Group A received Angelica Sinensis injections, Group B received a common herbal treatment of compound salvia, and Group C received low molecular weight dextrin injections. The results were striking. 78.7% of patients in the Angelica Sinensis group showed improvement, compared to 63.6% in the salvia group and 59.3% in the dextran group. A statistically significant difference that really highlights its therapeutic value in stroke recovery. In the field of gynecology, extensive research, particularly in China from the 1970s to the present day, has focused on validating Dong Quai's traditional role as a woman's tonic. These studies have consistently shown that the herb helps to regulate uterine contractions. This provides a clear pharmacological explanation for its long-standing benefits for relieving period pain. The herb appears to normalize the activity of the uterine smooth muscle, reducing the chaotic, painful spasms of dysmenorrhea and promoting a more coordinated, rhythmic pattern of contraction. This regulatory action is key to its effectiveness and sets it apart from simple pain relievers, as it addresses the underlying functional imbalance of the uterus. Epidemiological data has also suggested some intriguing long-term benefits associated with Dong Quai use. Some studies have found positive associations between its consumption and reduced risks of overall diabetes-related mortalities. Furthermore, it has been linked to a reduced risk of subsequent endometrial cancer in breast cancer survivors who use it. It may also prove useful in the long-term management of post-operative ovarian endometriotic cysts. However, it is important to note that research does not support the effectiveness of Dong Quai against menopausal symptoms when it is taken as a single herb. This aligns with traditional practice, as in traditional Chinese medicine, Dong Quai is almost always prescribed in a complex formula with other synergistic herbs. Finally, animal experiments have shed light on the biochemical pathways through which Dong Quai works. These studies have demonstrated that compounds within the root can regulate prostaglandin synthesis, which is directly involved in the body's inflammatory response. Additionally, the herb appears to regulate thromboxane A2, a substance that increases blood viscosity and promotes clotting. These mechanisms may explain its strong reputation as a blood tonic. Animal models have also shown its dual directional effect on the uterus, where it can increase excitability and transform weak, irregular contractions into slower, stronger, more rhythmic ones, providing a solid pharmacological basis for its use in dysmenorrhea. While Angelica Sinensis is a widely used and generally safe herb, it is powerful, and certain precautions are essential for its responsible use. In the system of traditional Chinese medicine, there are specific contraindications for its use. Practitioners advise against taking Dang Ghee in cases of acute diarrhea or abdominal bloating, as its moistening and enriching properties could potentially worsen these conditions of excess dampness. It is also contraindicated for individuals with hemorrhagic diseases or a tendency toward excessive bleeding, such as hypermenorrhea, which is abnormally heavy or prolonged menstrual bleeding. This is due to its blood-moving and potential blood-thinning effects, which could exacerbate bleeding disorders and lead to further complications that would require immediate medical intervention. One of the most critical precautions pertains to its use during pregnancy and lactation. Dong Quai should not be used during pregnancy unless it is specifically prescribed and monitored by a qualified healthcare professional who is well-versed in herbal medicine. Its ability to stimulate uterine contractions means it could theoretically pose a risk of miscarriage in some situations. Conversely, it is sometimes used by skilled practitioners in very specific formulas to prevent a threatened miscarriage, but this requires an expert diagnosis and should never be self-administered. Due to a lack of sufficient safety data, its use during lactation is also generally not recommended to avoid any potential effects on the nursing infant. A significant consideration for anyone taking pharmaceutical medications is the potential for herb-drug interactions. Because of its effects on blood circulation and platelet aggregation, Dong Quai may interact with anticoagulant and antiplatelet drugs, such as warfarin, clopidogrel, or even aspirin. Combining the herb with these medications could potentially increase the risk of bleeding and bruising. There has been a documented case report of such an interaction, where prothrombin times were altered. Therefore, it is absolutely crucial to consult with your doctor or pharmacist before using Dong Quai if you are taking any form of blood-thinning medication to ensure your safety and avoid adverse events. Regarding side effects, the oral administration of Dang Ghee is generally regarded as safe for most individuals when used appropriately. However, some people may experience mild adverse effects. Headaches have been reported in sensitive individuals, possibly due to the herb's vasodilating effects. Some sources also suggest that certain compounds in the root, Coumarins, may increase photosensitivity, making the skin more susceptible to sunburn. While this is more strongly associated with other Angelica species, it is a prudent precaution to use extra sun protection if you are taking Dong Quai. As with any new supplement, it is always wise to start with a low dose to assess your individual tolerance. As we conclude our deep dive into Angelica Sinensis, it is clear why this remarkable root has earned such an esteemed place in the pantheon of herbal medicine. From its ancient origins in the mountains of China to its validation through modern scientific research, Dong Quai has consistently proven its worth as a profound tonic, especially for women's health. Its ability to both nourish the blood and invigorate its circulation gives it a unique dual action that addresses the very foundations of health as understood in traditional Chinese medicine. It is not merely a remedy for symptoms, but a true restorative agent that helps the body find its own natural balance and rhythm. We have explored its multifaceted nature, seeing how it acts as a uterine tonic to ease menstrual discomfort, a circulatory stimulant to warm the body and speed healing, and an anti-inflammatory agent to soothe irritation. Its benefits extend to the digestive, cardiovascular, and even the nervous systems, showcasing its systemic effects. The research we have reviewed provides a compelling scientific narrative that supports these traditional uses, identifying active constituents like ligustilide and ferulic acid, and elucidating their effects on smooth muscle, platelet aggregation, and immune function. This convergence of ancient wisdom and modern science gives us a fuller, more complete appreciation of the herb's power. Remember, the key to using this herb effectively, as with all herbal medicine, lies in understanding its specific properties and applying them correctly. The distinction between Angelica Sinensis and Angelica officinalis is a perfect example of why precise knowledge is so critical in herbalism. While today we have celebrated Dong Quai, the queen of female tonics from the East, it is important not to confuse it with its Western cousin. Each has its own unique personality and purpose within the world of herbal healing, and respecting these differences is paramount for achieving safe and successful outcomes in your wellness journey. Thank you for joining me for today's comprehensive podcast about Angelica Sinensis. I hope this discussion has provided you with valuable insights into this incredible plant and its many gifts. The world of herbs is vast and endlessly fascinating, offering natural solutions that can deeply enhance our lives and the lives of our animal companions. Please be sure to join me again next week as I take a closer look at Angelica officinalis, which is the predominant Angelica species used in the traditions of Western herbalism. We will explore its different history, uses, and actions, continuing our journey into the powerful world of plants.